dwelling and they're an African-American male and they say, oh, well, maybe something bit you and it's really a lisinopril reaction. So we have to train people to not only be ethical, but equitable in the care that they give. And we have to make sure that we're addressing this across the spectrum, particularly post-incarceration, which again, increases the most is the increased piece for recidivism. Because if we're not addressing mental health issues, if we're not intervening immediately after their release, the chances of them re-entering the criminal justice system are quite high. It's that same cycle that's going to repeat itself unless we do something.
Thank you. You have anything to add to that, Judge Martin?
You know, I would be interested in finding out how nurses, along with social workers, can be more integrated into 911 calls or investigations. I think about the situation with Elijah Craig, or the gentleman in Rochester, New York, just recently that they showed the video. He was having a mental health crisis, and the police absolutely botched the handling of that situation. The young man the other day who was suffering from post-traumatic stress disorder, and his mother called and he lost his life. Sometimes when nurses can appear on the scene, or social workers, not that they would replace the role of the police, that's not what I'm suggesting, but they can intervene to say, look, this person has low blood sugar. They're acting out and they're acting in such a way, perhaps we need to check blood sugar. Perhaps this is a mental health crisis that does not cause or does not require restraint on the neck. In the Elijah Craig scenario, they gave that young man enough tranquilizer to put out an elephant. And if a nurse had been there, clearly that young man would still be alive. They clearly overestimated his weight and his size, and he lost his life.
And I'll just add to that, Judge Martin, because you're absolutely correct. And nurses can intervene through education. So maybe we need to educate police departments, EMS, EMT, first responders of how to identify situations like this. This includes things like we don't really consider, like autism. How do you interact with the person that has autism? How do you interact with the person who has a mental health illness? So it's important that we're able to not only, be on the scene or provide that, but also provide education. And I think we're a key group and a very trusted profession to be of and provide that service.
Absolutely.
There should be a nurse in every school.
Right.
Every school, without exception. And that's one of the things in last session we focused on, and we opened up the door for that. Of course, there's always a funding issue there. But there should be a nurse in every school, because the people in these schools, although they mean well, they're there to uplift and educate our kids, they can't deal with all these situations that they confront with. It takes a trained individual in many of these circumstances to deal with that, and nurses are perfectly prepared and able to deal in these situations. So I think it's very important the role that nurses play, and not just in schools, in prisons. I think in prisons and in those transitional situations that they have, I think they ought to have a robust presence of nurses and people that are trained at that level to deal with some of the issues that are bound to present themselves at these various levels. So nurses, I think, are critical. We haven't done enough in this regard. I'll just close on that particular point on a personal level. I've had an encounter in a medical situation with nurses and didn't really get to understand how important a nurse was, even though my sister was a registered nurse for 40 years. So I had a sense of it, but when you treat it by someone, you think there's a doctor there, but guess who really creates the context for you? It's the nurse. The nurse sets the pace, the nurse keeps you together, the nurse is making the observations, the nurse is filling out those charts, the nurse is bringing those, that's where it happens. That's where the rubber meets the road. So I think the nurses play just an incredible part, particularly in these situations where mental health, and not just mental health from the standpoint of someone's out of whack, so to speak, but I'm talking about just normal mental health that human beings need in terms of support in getting through stressful situations.
Yeah, I agree. I agree.
Entering the prison sentence system is traumatic,
Mhm.
very traumatic. And it's traumatic not only to the individual, but as they pointed out, to families, to
Mhm.
children. So those effects continue across the spectrum. It's not that, oh, my partner got incarcerated. It's my partner got incarcerated, and there's a domino effect that occurs because of that incarceration. And I think a lot of times that is quite frequently overlooked. So that's another way that nurses can intervene. Another way that healthcare can intervene is to provide resources. We do not provide enough resources. And I am a huge advocate of a nurse in every school because we have a special skill set that we can provide. We have public health experience, and we can hopefully decrease this problem and make it so that there are less people entering the prison system. There are so many things that nurses can do to intervene. I can't, stress that enough. And I'm just an advocate. So
I agree.
And if we quit locking everyone up, we could free up some money so that we could provide these services. And I will share with you, surprisingly, Kentucky leads probably the region. In fact, it does lead the region in incarceration. It's very surprising. I was shocked to learn that when you consider West Virginia, Ohio, Illinois, which has an urban area like Chicago, Tennessee, Indiana, North Carolina, Kentucky's number one in jail admissions, prison admissions, jail sentence population, prison population. We're second in pretrial population. Now, we lead the nation in child abuse, incarceration, illiteracy, cancer. Thank goodness for West Virginia, Mississippi, Louisiana, and Arkansas. Are we be at the top of the heap in every bad category?
And I'll add to that, Judge Martin.
Which is a sad thing.
Judge
We
Martin,
have to do better.
and we also lead in actual prisons. So the actual number and frequency number of prisons in the state for federal prisons is Kentucky's one of the top states that has the number of federal prison systems that are located here because of tax rebates and staff and open areas. So that's another thing too. We have, I think, over 5 male federal prisons in the state. So
Senator Neal, can you tell Senator Stivers if he wants to cry again on the Senate floor, don't be crying about the UK basketball team. Cry about Kentucky being number one in all these statistics. Tell him to come.
I think it's good to see an expression of
Emotion. Right, but it needs to be about
sometimes we operate up there and you just start thinking that everyone's like has a steel heart. But quite frankly, what I have found that these individuals just have cultural biases. We all have biases of sorts.
Right.
And trying to get all those diverse perspectives on the same page with the same piece that's motivating is a very difficult thing to do. And the whole legislative process is difficult. Mm-hmm. But I will point out, though, that it's very important for us to, I think, to rethink what we're doing in terms of what does punishment mean? Mm-hmm. What does justice really represent? We ought to have a robust discussion from top to bottom about that. Mm-hmm. And I think the testimony of those who are trained professionals, such as nurses, must figure into that. We haven't had a sufficient robust discussion because we got this thing, if you do the crime, you got to do the time. Well, time where?
Right.
And at whose expense?
And sometimes
we examine these things. Yes.
Sometimes what crime? We've had so many people accused and have served time. So that's the piece too. Is there a crime?
It's also interesting to see how the treatment program and concern has popped up all of a sudden, because now we have people not necessarily of color who are addicted. Now, you remember when we had the crack epidemic at first, it was Black people and there was no cry for treatment. Now that we have our brothers and sisters out in Estelle County and Leslie County and Martin County and Bell and Callaway County, and the opioids are hitting home in rural areas,
Yeah.
there is this absolute concern that we need to provide treatment. I'm glad, but it also brings up the racial disparities that we cannot ignore.
That's right.
Which starts with the creation of laws. The movie and the documentary, The 13th Amendment, if you guys have had a chance to watch it, 13 on Netflix, that was produced by Ava DuVernay. Wonderful movie, wonderful background about the prison system and the pipeline and the job system and the whole world that exists within a prison. It's so important to know that those biases, the segregation, the racism doesn't stop because they are in the prison system. It continues on. And as Judge Martin said, prosecutorial misconduct is high. Prosecuting individuals for low-level offenses. My father speaks frequently of the heroin addicts that came back from the Vietnam War, but that wasn't addressed as it's being addressed now. It's now a priority because of race and who it impacts. So I think that's very important, is that there is always a racial, ethnic piece, a bias piece that plays a role in the enactment of laws, administration of laws, and enforcement of laws. And Senator Neal would be the expert on that.
Well, there's another dimension to this as well. The disparities are obvious, and we can go back historically to explain the mindset and how that's played out. But if you really stop and think about it, take Kentucky, for instance, we have approximately 24,000 individuals in state prisons. But think about it, we have about 13,000 on average in county jails, in local jails, either on their way to prison, pre-adjudication situations, some post-adjudication situations. So you add that number up, 24,000, now you got 37,000 people that are incarcerated, and that's not dealing with who we have in federal prisons in Kentucky, just as an example. So, Kentucky's out of whack on many levels, and it just doesn't make sense. Now, some will argue that because they incarcerate so many, that it drives the crime rate down. I would argue that we waste the potential for using and developing and refurbishing, if you will, the talents of individuals that are contributors to society. And that deficit, if you actually got into what that means, it's a loss to us. It's a net loss with respect to that. So it's all out of whack. That's the only way I can really put it. And it's not philosophically sustainable. It's not morally sustainable. And it's certainly irrational in terms of outcomes that I think we ultimately would want to have.
Well, I want to thank everyone for coming to our discussion. We could probably talk about this issue for days. And I want to thank our panelists for the robust discussion. It was, I think nurses are going to have to really think about their involvement in, the issue with incarceration, because I think our voices really are needed there. So thank everyone for coming. Don't forget, our next night is March 25th. We're going to discuss Cooked, and it's about the heat wave that hit Chicago and all of the deaths that occurred from that. So it's a little bit of climate discussion as well, along with healthcare and government, and how they handle crises like climate change issues. So thank you everyone for coming, and I hope everyone has a great night.
Good evening.
Thank you.
Thank you. I'm gonna add one more thing. If you guys do get the time, please look at Michelle Alexander's The Prison Industrial Complex and the movie documentary 13th. Prison is big money, and that does play quite a big role and incarceration in this country. So just a little bit of homework for you guys.
I agree. Erin.
Audience, I appreciate the time and attention you've given this. Thank you.
Thank you
Thank
so
you.
much.